Well, hello, all you microbiology enthusiasts. I'm thinking of microbiology majors, nursing students, pre-med, pre-dental, allied health professionals. I'm here again to record another video covering topics in medical microbiology. Again, as I've been emphasizing in my previous recordings, my previous videos. Microbiology is such a large field that it's impossible to cover every aspect of it. So the previous few videos, I was giving you an introduction of the field as a whole, giving you an overview of the various disciplines within microbiology, like microbial ecology, food microbiology, industrial microbiology, but I'm going to concentrate on the clinical or medical microbiology, which deals with microbes that impact the human body in relation to, state of health, various infections. So in this video, I have about 8 slides. I'm going to go over a specific topic. I'm kind of narrowing it in this whole series to clinical aspect of microbiology. So the human body has microbes in us, on us, around us. The microbes that are in the human body or on the skin of the human body, they can be categorized into two types. We call those microorganisms that cause disease or cause infections as pathogenic microbiota. Now, don't let this word microbiota throw you off. It simply means the whole population of microbes that can be found in the human body in both a normal state and a pathogenic state. So normal microbes that exist naturally in various parts of our body are called normal microbiota, as opposed to the pathogenic microbiota or microbes that cause various infections. Now, even within normal microbiota, remember those are normal in a specific area of our body. For example, they're normal organisms that are found in the large intestine because they do a job there. There are normal microorganisms found in the small intestine, found in the mouth, and various other parts, anatomic structures of our body. However, you must understand that even though they are normal in one region of our body, if they were to migrate to another part of the body, there they would become pathogenic. And in future videos, I would give you several examples. For example, there is one case study that I've covered with my classes, which deals with an operating room procedure where an anesthesiologist was either talking without his mouth covered, something happened, and he exposed the normal microbes in his mouth, where they do not cause any problems. He exposed those organisms to the patient who was being worked on, which means those organisms normal in his oral cavity were transferred into the bloodstream of the patient while they were operating. When they got there, they now became pathogenic because they traveled to the nervous system carried by the blood, and they over there in a different environment, they caused an infection. They caused meningitis. Again, that's why I need to emphasize that these normal microbes are only normal in their assigned anatomic region of our body. Okay, let's move on to slide number 2. Slide number 2 is basically kind of a summary slide that shows the various parts of our body where microbes can be found normally. But again, remember, they can also be become pathogenic if they migrate from their normal area. So the next few slides, I'm going to go over some examples of organisms or microbes that are normal in various parts of our body. For example, your tongue, you can see a whole bunch of different microbes that are designated by different colors. They're normal on your tongue. Again, and they have a role to play there. In the small intestine, there's some that are normal in that area. In the female, slide number 4, in the female urogenital region, you can see certain microbes, and this is critical because, for example, this particular normal microbiota in the urogenital region, especially in the female, they provide an acidic environment. For example, one of those is lactobacilli. They provide an acidic environment, they lower the pH, and this plays an important role in keeping out other microbes that don't grow well in low pH to reduce the risk of infection. So if the normal microbiota in the urogenital system were to be somehow removed, as in douching, ladies, that would give room for the pathogenic organisms or the opportunistic organisms like yeast to take over and cause an infection in that area. Same thing in the large intestine. You can see several different little organisms in the large intestine. They play a very important role. If you have taken Human Anatomy and Physiology Part 2, the digestive system is an example where you would have covered how certain normal flora or normal microbes in the large intestine do play a huge role. They complete the digestion of any food that our body does not have the capability to digest. Examples of plant foods. You eat, for example, beans or lettuce or some other plant-based food, your body may not have all the enzymes needed to complete the digestion of those foods. So these normal organisms in the large intestine would do that for you. In addition, there's some of them that produce various vitamins and factors in the large intestine. So they do play a role. Slide number 5. Now we're talking about pathogenic organisms. For example, and many of them you have heard of, I'm sure, in one aspect or another. For example, the bacteria that causes tuberculosis is not normal in the lung. So of course it causes disease, it causes infection, it causes TB. Same thing with the ongoing infection with COVID virus 19. It's another microbe that is pathogenic in the lungs. Slide number 6 gives you another example of pathogenic microbes in the blood. In this case, we're looking at a blood smear with the parasites, the malaria parasites in the shown on the smear with blood cells around them. Of course, there's the bacteria that causes the disease cholera. This is Vibrio cholera, and again, you can find this in samples of stool, because this causes one of the symptoms is diarrhea. So obviously, usually acquired or found after a person has ingested contaminated food or contaminated water. Of course, they eat that food. The result is diarrhea. And of course, the microbiology lab, the job they have to do in this case is work with a specimen, however loose, a diarrhea specimen, and examine that for the presence of this microbe in that stool. And that would be one way to identify the causative agent. Needless to say, there are other organisms that are pathogenic in the oral cavity. Example, when you get tooth decay and the resulting cavities, is because microorganisms over time, especially if you care for brushing your teeth regularly, those microbes would set up housekeeping on your teeth and start ending up damaging your your tooth. And finally, another example of a different kind of microbe. This is a fungal infection. Remember, fungi are one of the 5 groups of microbes that we deal with in medical microbiology. In this case, you have a fungal infection of the skin. Ringworm is a fairly common fungal infection. So these few slides hopefully give you an example of what I mean by normal pathogens, normal microbes versus pathogenic microbes in the human body. And this last slide basically is to emphasize or highlight the relationship between those two categories of microbes, the normal microbes and the pathogenic microbes. Medically speaking, the human body can have any of these organisms in whatever part of our body at the same time, living side by side. The ones that cause disease as well as the normal ones. So the role of the medical microbiologist and the reason we're studying medical microbiology is we want to understand how one can separate the normal microbes from the pathogenic microbes when a patient sample is submitted to the microbiology lab. Remember when the doctor says you need to submit a stool specimen or a urine specimen or a sputum specimen, you can expect that the specimen is going to contain or carry both the normal microbiota for that part of the body, as well as the criminal organism, the pathogenic organism that is possibly causing the infection. So that is a crucial role in microbiology, and one has to understand why microbiology plays a huge role. So the medical microbiologist would receive that sample and separate, of course, the normal from the pathogenic microbes by various techniques like isolation, streaking. Again, we'll go over that in future videos. Once they have identified the colony that is potentially the colony of the pathogen, they would perform several tests to put together information of the characteristics of that organisms, and that the results from those tests would provide what I call the identifying evidence of the criminal microbe causing the infection. They would send that to the pathologist and to the physician with the potential identification of the pathogen they have identified, and based on the information from the microbiology lab, the physician will then decide what kind of treatment to prescribe for this particular infection. So you see why it is so important to understand some basics in medical microbiology. If you have any comments or questions, you can always post them below this video, or you can email them to me. My email address is WANKOKO, then the letter S, the number 52 at gmail.com. And I would do my best to address them.